A patient recall is nothing more than an appointment type that the doctor wants to see the patient again for in a couple of days, weeks, or months. There are three ways to schedule a recall. Once the recall has been scheduled, there are also three ways in which to capture a patient's recall that is coming due. Due meaning the time the doctor wanted the patient called and scheduled for the specified recall appointment type. But first, let's go over the three ways a recall can be posted, and they are 1. Through the online charge slip, 2. Through the recall screen, and 3. Using and setting up the recall defaults. We'll start with the online charge slip, where the provider not only posts charges for the patient, but can post a recall at the same time. We'll go up and we'll click on the online charge slip button. So what the doctor normally does in his online charge slip screen is over to the left he's got his to-do list of patients that have been scheduled today that he needs to post charges for. Let's say for Mark Andrews. He'll go over and check the boxes of the charges, of course, and also the diagnoses down below. And then when he's ready to post a recall for the patient, let's say for Mark here, he wants to see the patient for, as a follow-up, in maybe 3 days. After you go ahead and set the fields, click Save, and you got your first recall. You can also add additional recalls line item by line item, but to keep things simple, we'll just schedule one recall for Mr. Mark Andrews. And then all I have to do is go over here and click on Process, and that will do two things. First, it'll post the charges you see up above, and then down below, it'll also process and post the recall. Now, recall isn't going to schedule the appointment. It's not going to schedule it on October 30th. That's when it's due. And what that means is that the provider wants to see Mark again for that particular appointment type in 3 days. And once he clicks Process, this will be viewable in both the recall report and recall screen, where the front office can view the list of recall dates to call and schedule a patient for. And then once we click Process, it removes Mark from our to-do list. We'll go ahead and close out. Now, to keep our thoughts all together, what the front office is going to do is they're going to come up here and click on the recall button. Now, they don't know when Mark Andrews is supposed to be recalled. I mean, we saw it was 3 days on October the 30th, but we don't know. So what we can do as a front office, we can do this on a day-by-day basis, or say for the current month of October, who do we need to recall? Well, we already have two here, Josh Bracken, and there's Mark, and he's supposed to be recalled and it's due in October. Of course, if we go to the next month and we select next month, and let's say we want to find it for November and click refresh, Mark Andrews not pulling up in that month because, again, it's on the date that he's supposed to be seen or recalled to see the doctor again for that particular appointment type. So again, we go back to the current month. We call Mark up by looking at his phone number here, dialing it, and then Mark says, yes, I can come in on the 30th. Great. Really simple. All you have to do is double click really fast on Mark Andrews' name. It opens up the appointment scheduler on the exact date, October 30th, that Mark is to be rescheduled or recalled. So all we have to do is left click on the time and make the appointment. Now, it's very important when you make the recall or when you schedule the appointment, you select the exact same appointment type that Mark was recalled for, and it was follow-up. The reason why is because if I select anything else besides follow-up, he's still going to be listed in that recall screen for a follow-up, because the only way to remove his name from the recall screen is by exactly scheduling the appointment type here that the doctor asked for, which is the follow-up. Go ahead and click OK. Again, this is a follow-up. He's been scheduled. And you'll notice in the lower left-hand corner I didn't close out of the recall screen, but I can go ahead and click refresh, and now Mark is no longer in our recall list. However, keep in mind, and I'm going to go back to the appointments, whatever you do, if Mark doesn't show up on this date, you don't want to delete him. If you delete him, he's going to pop back up on the recall list. So I'm going to delete him, go back to my recall and click refresh, and he pops back up. That means he was never scheduled or had the opportunity to come in. So we'll go back, double click, and we'll schedule him again for the follow-up. And instead, if Mark doesn't show up, what you want to do is left click on him and do either a cancel or a no-show. And of course, because this is in the future, I'm not able to do it right now. But if you click cancel no-show, it'll remove him from the screen here, and then you can go back to the recall list and it will be removed as well. And by the way, while we're here, this screen you can also not only view the recalls that you need to call or that the doctor has scheduled for recall, but you can also add them as well. Just click on the Add button. Go ahead and pick your recall date. Say it's on October 31st. Find the patient, and we'll say it's Jeff Bradley. Double click, and then what appointment type do we need to recall Jeff Bradley for? And he's obviously tied to Dr. Rice, so click on the button for appointment type, and let's say it's going to be a follow-up. Go ahead and save it, and you'll see he's still part of the month. Now keep this in mind, even though it says November here, The option is current month. So unless we have it selected down here, we're not pulling for November, we're only pulling for October. Now the third and final way that you can post a recall. Go up under the Master Files menu down to Recall Defaults. I'm looking at the bottom section here, and basically anytime I schedule an appointment type, like new patient visit, I'm going to have tied to it the next appointment type that's automatically going to be posted as a recall. For example, let's pull up the Dr. Rice and say that anytime somebody schedules an appointment type for Dr. Rice eye surgery, the next appointment type or the recall default that will automatically be posted will be, let's say, glass fittings. And they'll come back for that glass fitting in, let's say, about 3 weeks from when they were first seen for the initial appointment type eye surgery. Of course, we do want to select our charge slip as well, standard, and then be sure to save your work. So anytime somebody schedules eye surgery, the next appointment type is going to be a recall that will show up in the recall screen. Let's go ahead and take it for a test drive. Going to go to the appointment scheduler, pull up one of Dr. Rice's patients, say Carrie Heffernan. Going to schedule Carrie here. And of course make sure you schedule the correct appointment type because the next follow-up appointment type is going to be tied to it, and remember, it was eye surgery. Click OK. Now that the eye surgery has been scheduled, it's still not going to pull up in the recall screen until we actually check Carrie out. For example, if I go to the recall screen right now, and it's 3 weeks from today, which is going to be sometime next month in November, and I click refresh, I get nothing. However, once we're done with Carrie and we left click and we check her out, she's checked out now with the pound sign, I can go back to the recall screen. In 3 weeks, of course that's going to be in November, refresh, and there she is, she's ready to be recalled. And then of course you're not always going to know when to recall somebody unless you select ahead a couple of days. In this case we're still in October, I'm looking at November. I call Carrie up today and try to get her scheduled, and if she agrees, just again double click on this, it goes to the appointment scheduler, the exact same date that the doctor wanted to schedule a recall for, November 17th, and then of course like we just seen, go ahead and left click and make the appointment type. Another way of doing this, if you didn't want to do it through the recall screen, is going under the reports menu to appointments, and then over and down to recall visits. And this report is going to contain a list of all the patients who need to be recalled or scheduled for a recall. Go ahead and choose your low and high date. Now remember, I don't know who needs to be seen in the next month. So today is October 27th. I'll select that as my low date. And then if I'm making calls for patients up through, let's say, November of next month, because we know Carrie is supposed to be recalled in that month, to November 30th, I click Generate. Just like the recall screen, only it's going to be in report format. And if I can maximize that, you can see Carrie has not been scheduled yet for a glass fitting. As soon as she does, she'll not only be removed from this report, but also, as we've seen, she'll be removed from the recall screen. Now the third and final way to view and schedule recalls is through the patient checkout. Click on the checkout button. Now you can watch the training video on patient checkout, but to keep it simple, you can see down at the bottom you can post payments in the patient checkout, post the payments and recall a patient, or just simply recall a patient for a future appointment type. Now these buttons will only be available if the doctor's posted a charge and also scheduled the patient for a recall along with the charges. Otherwise you won't be able to recall with your posting of payments or just recall at all. So for example, if you look at Mark Andrew, the doctor has not posted a recall, so all we can do is post a payment in the patient checkout. Let's go ahead and take it for a test drive. We'll close out of here, we'll go to our online charge slip, and let's go ahead and post charges for a particular patient and include a recall to see what it looks like in the patient checkout. Let's say for Sherry Brown. We'll go ahead and we're the doctor, we're checking off the diagnosis and procedure codes, and then down at the bottom we'll say that we'd like to see Sherry Brown for a follow-up appointment type in, let's say, 2 days. Be sure to save the work and then go ahead and process the charges and the recall. Sherry Brown's now removed from my to-do list of posting charges. Close out. We're going to go back to the patient checkout screen, and as you recall from Mark Andrew, all we could do is post payments or just check him out here. And again, you want to watch the patient checkout video, but for the sake of simplifying, we're looking at Sherry Brown, we can post charges and do a recall. And all that means is that after we post a charge, it'll automatically pull Sherry Brown up in the appointment scheduler on the date that the recall is due, which is October 29th. If we're not posting any payments, then we can just simply do a recall. And automatically it pulls us to October 29th, the date that the doctor wants to see Sherry Brown, which is a Sunday.